Hello and welcome to Pediatric Doctor at Home, where we share concise and practical medical tips with caregivers, to help improve the health of children and young adults. Today's discussion is about the consumption of milk, specifically cow's milk. Here are 7 things to know about milk intake in children. We'll start off with the benefits of the highly nutritious cow's milk. It is an excellent and affordable source of protein, the building block of every cell in the body. Cow's milk also provides calcium for strong bones and teeth, as well as other nutrients like vitamin B, phosphorus, potassium, folate, magnesium and zinc that are important for the body's metabolism and disease prevention. In many countries, cow's milk is fortified with vitamin D, which helps with calcium absorption and healthy bones. But are certain situations when taking milk may be problematic? Yes, and this brings us to the second point: cow's milk allergy, when there's an abnormal immune response to cow's milk. In people with an allergy, the body erroneously recognizes the proteins in cow's milk as harmful, and launches an attack against the protein. This often results in injury to the person's body, producing symptoms like itchy rash, hives, swollen face and lips, trouble breathing, abdominal pain, and vomiting. If it looks like a child has had a reaction to cow's milk, please seek medical care. A severe allergic reaction, called anaphylaxis, is a potentially life-threatening medical emergency that must be attended to immediately. Lactose intolerance or milk intolerance is another condition that can arise from milk consumption. Unlike cow's milk allergy, this is not an immune problem. Lactose is a complex sugar present in milk. Individuals who are lactose intolerant are deficient in lactase, an enzyme found in the small intestine that is needed to digest or break down lactose. This leads to symptoms like belly cramps, gas, bloating and diarrhea. Although these symptoms are unpleasant, lactose intolerance is not dangerous. To manage this condition, discuss with your doctor about limiting foods with lactose or trying lactase supplements. Moving on to the fourth point: when should a baby transition from breast milk or formula to cow's milk? Experts in pediatrics advise to wait until a child is at least 12 months old before introducing cow's milk, for the following reasons. Cow's milk does not have the ideal proportion of protein, fat and carbohydrate present in breast milk or commercially prepared infant formula. The high amount of protein puts a strain on the baby's developing kidneys. Additionally, early transition to cow's milk can lead to anemia, a condition where there is a lack of healthy red blood cells to deliver oxygen to the body. Iron is required to produce red blood cells. But cow's milk is low in iron, and the iron is in a form that is not easily absorbed and utilized by the body. Cow's milk can also cause anemia when the milk protein irritates the walls of the child's intestines, leading to blood loss in the stools. Therefore, it is best to avoid cow's milk in children before their first birthday. Number 5 is the amount of milk intake. It is recommended that toddlers and children drink 16 to 24 ounces of milk daily, that is, 2 to 3 cups per day. Too much milk fills up a child and reduces appetite for more nutritious and balanced meals. Secondly, excessive cow's milk results in iron deficiency anemia due to the low iron content and poor absorption of cow's milk, as previously explained. Undiagnosed and untreated iron deficiency anemia in children may lead to serious complications including developmental delays and heart failure. Number 6. What type of cow's milk should children drink? The type of milk depends on the percentage of fat in it. Whole milk contains around 3.5% of fat, reduced fat milk has 2%, low-fat milk 1%, and non-fat skim milk is fat-free. Note that milk consumed by children should be unflavored and unsweetened. Although the amount of milk fat affects the total number of calories, all the types of milk are similar in proteins, vitamins and minerals. Pediatricians recommend that children 12 to 24 months drink whole milk because they need the calories from fat for growth and brain development. Then after 2 years to drink low-fat or skim milk, mainly to avoid the extra calories, considering rising childhood obesity rates. How about organic versus regular milk? The difference between organic and regular milk is in the agricultural method used in their production. For regular milk, farmers may use pesticides to control weeds in the pasture area, give growth hormone to cows to boost milk production, or administer antibiotics to the cows to decrease the risk of infection. Residues of these chemical substances may be present in regular milk. However, these measures are not done for cows raised to produce organic milk. Since it costs more for farmers to raise drug-free, open pasture-fed cows with lower milk yield, organic milk is more expensive than regular milk. Compared to regular milk, organic milk has higher omega-3 fatty acids that is beneficial to the heart, brain and immune system. It also has a longer shelf life as it is sterilized at a higher temperature than regular milk. Nevertheless, many countries have agencies that regulate the production of milk, and regular milk is considered safe to consume. Did you find this video valuable? Then go ahead and give a like and subscribe. Thank you for watching.